Hi, my name is Dr. Stephen Smith from smithfacialplastics, and I want to talk a little bit about one of the newer modalities that we have in our practice. We've been using the TriLift by Lumenis for over a year now. I've used it personally. My wife has as well. We had a daughter get married in September, and it was a great way to glow up prior to the big event. But people wonder what it is and why we use it, how frequently we use it, and who's a candidate. So TriLift, there are three components to it. One is radiofrequency microneedling. And so the radiofrequency microneedling on the TriLift is the thinnest needle on the market. And the nice thing about that is patients can have that service done without having numbing ahead of time. A lot of our other services require topical numbing for at least a half hour in order to tolerate the procedure. The other nice thing about the ultra thin needle is that the recovery and downtime after the procedure is very minimal. I've had the procedure done multiple times on my neck. This is a 55-year-old neck. I'm trying to keep it in a non-surgical state. I'm holding on for dear life, but this is the tool that I'm using, along with some other things to help me out in that regard. Now, each of those treatments that I had, I was red for a couple hours or maybe the afternoon and looked pretty normal the next day. And that's a nice feature. The other nice thing about the depth of the needle is there is very, very little risk of melting or disintegrating fat. So that's a big concern with some of the radiofrequency microneedling devices is, am I going to lose these important youthful fat pads, temporal fat pad, malar fat pad, subcutaneous fat in the neck, which would make the skin look crepier? And the answer is not with this device. I think some of the other radiofrequency microneedling devices, including ones that we have, put us at a little bit more risk for that. So that's one component. The other component is the dynamic muscle stimulation. And filler is somewhat controversial these days. I still love filler for the right candidate. But this is a great way to volumize areas where we're losing volume, especially in the face, without using product. And the concept is all these facial muscles, in particular the mid-face strap muscles, are muscles that attenuate, they atrophy over time. And when we have that atrophy, we lose tone and things settle, sag, and we lose volume. By using dynamic muscle stimulation, we can contract those muscles and stimulate them to be fuller, tauter, kind of like going to the gym. Now, the downside of that is it requires some frequency. The protocols that most of my colleagues around the country are using are a series of three treatments. Sometimes it'll be staggered with some of the other modalities on this, but then there's a maintenance probably every 6 months or so. But I think it's a great way to get yourself tuned up for a special event, in the family, in society, or a reunion, just something that might be important to you, without, using filler as a product. It's a very well tolerated procedure and there's no downtime afterwards. But again, there's some maintenance associated with it. And the last component of it is radiofrequency delivery of heat. That's just meant to stimulate the collagen to produce some hyaluronic acid, tighten collagen bundles. And it's kind of like a lot of the other devices that are out there in the marketplace, but it can be combined at the same time that the dynamic muscle stimulation's done. So it's a 2-for-1 sort of approach to some of the age-related concerns that we have. So the downside of this is there is maintenance associated with it. The upside is that the cost is fairly nominal compared to some of the other modalities out there. And without downtime, without pre-treatment numbing, it's a great way to address some of the concerns that we all face as we age.